You can think of Medicare as being made up of four building blocks to cover different aspects of medical care. The first two blocks are Parts A and B, also called Original Medicare. It's managed through the federal government. In Original Medicare, Part A covers inpatient hospital stays and limited amounts of skilled nursing care. Part B covers outpatient medical services. You can also add Part D, which is drug coverage, and a supplemental insurance plan called Medigap plans. Part C is called Medicare Advantage. In this plan, private insurance companies offer plans that bundle all the things covered in Parts A and B. Part C is not administered by the federal government, but the federal government does regulate these plans. Most Medicare Advantage plans include coverage for drugs and other costs without needing separate plans.
Part A covers inpatient hospital care, rehab care in a skilled nursing facility, and many other institutional care services. Part B covers doctor's visits, doctor's bills, diagnostic screenings like mammograms and prostate exams, and other outpatient care like ambulance services, some medical equipment, and other preventative health care aimed at keeping you from getting sick. For example, this includes care in the emergency department and observation services. Part B also covers medically necessary items and services you receive outside of the hospital, such as durable medical equipment like blood sugar monitors or wheelchairs. With Original Medicare, you are free to choose your doctor and healthcare providers, since nearly all healthcare providers participate in Medicare. There are two central choices you have to make once you decide to enroll in Original Medicare. One is knowing which Part D drug plan you want to sign up for, and the other is deciding if you want supplemental insurance. Knowing the answer to what drug plan you want is important. While the federal government provides your Part A and B coverage, you need to choose a private insurer for a Part D plan. Generally, a Part D plan is selected based on the ones that provides the lowest costs for your specific medication. Likewise, deciding if you want a supplemental insurance plan is equally important. Parts A and B require some out-of-pocket costs when used, and the more healthcare you need, the higher these costs can run. About 3 in 10 Original Medicare enrollees buy supplemental insurance, also known as a Medigap plan, that covers many of the out-of-pocket costs such as deductibles and copays and other charges that Medicare doesn't cover.
Part C plans, known as Medicare Advantage, cover all the same services as Parts A and B, but through private insurance companies using networks of healthcare providers. Also, most Medicare Advantage plans include Part D, which covers most of the costs of prescription drugs, both generic and brand name. With Medicare Advantage, you get a planned network of doctors, other healthcare providers, hospitals, specialists, or services. So if you prefer a network approach to healthcare, you have some simple investigating and choices to make, such as researching the Medicare Advantage plans and providers near you. The Medicare Plan Finder on Medicare.gov is a useful tool for finding Advantage plans in your county or zip code and comparing the services and coverages they provide.